fine. I heard you'll be one of us.
Yes.
So congratulations for getting into med school.
Thank you.
Yes, and I'm very excited for you to experience what PBL is.
I'm actually worried about the PBL. I don't know how it works and I heard it's scary, especially for someone like me who's shy.
Yeah, I understand you. I feel all of the feelings that you felt. And no, don't get worried. For me, actually, PBL is one of the best curriculum I've ever experienced.
Really? So how does it really work?
It's like this.
Hello.
Hello.
How are you today?
Good. Great.
Nice. Always nice to be with students. Okay, so grab your attendance. So, how's been medicine so far? So, for those of you who are not familiar with me, I'm Dr. Kunting and I'll be your facilitator for today.
Problem-based learning, or PBL, is a method of teaching aimed at giving the learner effective skills in problem-solving, self-directed learning as a lifetime habit, and teamwork, all while acquiring an integrated body of knowledge from many different subject areas or disciplines. In PBL, there is a facilitator instead of a teacher. He will scaffold student learning. He will facilitate the proceedings to ensure that the group achieves appropriate learning objectives in line with those set in the module.
So, let's introduce ourselves. Can we ask the beautiful lady on my right? State your name, your pre-med course, and the reason why you decided to go into med school.
Hello, good morning. My name is Minette Emmanuel and I graduated BS Biology from Western Mindanao State University, batch 2014.
Hi Doc, I am Johnson Isagani, Vipulis III. You can call me Jepo, and I am a graduate of BS Chemistry 2013 from WIMSU. WIMSU is Western Mindanao State University. I took up medicine for a stepping stone to be a future researcher about polymers.
Hi fellow doctors, my name is Muzo Wiram Elang, a BS Medical Technology graduate from Universidad de Zamboanga. I took up medicine because I know I could help more people as a doctor and of course to please God by doing good deeds.
Hi guys, I'm Richmond Rongo. I'm a graduate of BS Agriculture.
Just kidding.
I'm a graduate actually of BS Nursing. I'm from STI.
I'm Archel Bacalso. I graduated BS Nursing at WIMSU and I want to become a doctor because I know that God has planned me to become a doctor.
Hi Doc, my name is Salwa Ahmad. I'm a BS Bio graduate from WIMSU and want to become a doctor because there were instances in my life where the presence of a doctor was really necessary, but unfortunately there's no doctor at those times. So want to become a doctor to serve our place. And by the way, I'm from Tawi-Tawi.
Okay, so now we are comfortable knowing each other, so I hope that we'll be able to share information as we go through this 3-day course. So let's begin. Let's assign somebody to be our scribe. Who wants to be scribe?
I can do it, Doc.
A scribe is a member who writes the points made by the group. The facilitator starts the session with a presentation of a problem. The students then will explore the problem, share their knowledge and experiences, create hypotheses, and identify and elaborate issues.
This is a case of MN, a 45-year-old male who came in with a chief complaint of multiple stab wounds. So what are the problems of this patient?
Because of the multiple stab wounds received by our patient, there could be an extensive amount of bleeding which may cause hypovolemic shock.
So you're saying one of the problems would be?
The hypovolemia.
It is also possible, Doc, that the patient has an acute abdomen.
It can also be an intra-abdominal pain.
So with these problems that you have written down, do you think you can make a diagnosis of this patient?
Not yet.
What would you like to know?
Can we have further history?
The history? Okay. What would you like to know in the history?
When did the stabbing happen?
Also, the place of incidence, Doc, so that we can estimate the transport time.
Okay. In terms of the body parts, I think that is something that we can talk about in the physical exam. But we can talk about history, okay? So the patient was stabbed at about 4 in the morning. He was having a drinking session with his friends, and he was stabbed with an ice pick several times in the left upper, right upper, and his left lower quadrants of the abdomen. Patient is known to be heavily drinking during that time. Are you satisfied with the history?
Not, Doc. What happened po after he was stabbed?
So, some concerned citizens found him and brought him to the hospital. There was a large amount of blood.
Did he lose consciousness?
The patient was unconscious when he was brought into the emergency room. Without history, do you think we can rule in or rule out your problems of this patient?
No, Doc.
What else would you like to find out?
Can we know about the physical exam, Doc?
Physical exam?
Yeah.
What would you like to find out in the physical exam?
The vital signs and ability sa conduct.
The vital signs are the following. Blood pressure is 80/60, heart rate of 124, R of 24, and the auto saturation is 92%. Okay, so now that you have the vital signs, what else would you like to find out in terms of the physical exam?
Wait, can we do it cephalocaudally?
Okay.
Okay, how about the conjunctiva, Doc? Is there any pallor or anything?
Patient had pale conjunctiva.
Excuse me, I'm from a chemistry field. Can you, if you don't mind, explaining what cephalocaudal means?
Okay, so cephalocaudal means we are going to assess the patient from head to toe, so that will be systematic and no, nothing will be forgotten.
So we're done with the HENT. What about you, Musa? What would you like to find out?
How about, Doc, the physical examination on the chest and lungs?
The patient had equal chest expansion, but he was breathing rapidly. So we're good the other systems. What about you, Salwa?
How about the abdomen, Doc?
The abdomen? Well, the abdomen was tender on palpation.
Tender? What do we mean by tender, Doc?
Would anybody like to explain tenderness?
By the way, tenderness simply means pain on palpation.
How different is tenderness from pain?
It's a little bit tricky.
Well, if you're not sure,
I'm not sure.
we can look it up. That is called a learning issue. Things that we don't know, we read about it and then we report it the next day. Scribe, can you write it down? Our learning issue number 1 is what's the difference between pain and tenderness. So let's not neglect our scribe. Emma, what would you like to know about in the physical exam?
About the extremities, Doc.
Okay. The patient has steady pulse.
Students are encouraged to identify what they already know that is pertinent to the problem and identify what they do not know. And that is what you call learning issues.
Okay, so based on your history and physical exam, what do you think is the problem of this patient? Archel?
Doc, based from my previous knowledge, shock is when there is a depressed body function due to injury because there's already a loss of blood and oxygen.
So, you're telling us, Archel, that the patient is in shock?
Yes, Doc.
What are the other instances when shock occurs?
No, Doc, but there are many kinds of shock, and one of them is hypovolemic shock, right?
Any other types of shock that you know?
Besides hypovolemic shock, Doc, I'm not really familiar with other kinds of shock.
Would you like to make that as a learning issue?
Yes, Doc.
Okay. Moving on, what can you say about this patient? Our scribe.
Doc, since there are multiple stab wounds in the abdomen, maybe doc, there are also internal organs damaged.
Internal organs damage. Muzao. What are the most likely organs damaged?
Depends, Doc, in which quadrant the patient was stabbed.
Very good insight. So that would mean that you would always consider where the site of the injury is. Salwa, do you agree?
Yes, Doc. We need to be familiar with the anatomy of the abdomen to relate the location of the injury to the organs involved.
Can you draw for us the quadrants of the abdomen? Johnson, while Salwa is drawing the quadrants of the abdomen, can you tell us what are the organs underneath?
I may not know the lower quadrants, Doc, but I know both the right upper and the left upper quadrants, which is the liver and the spleen.
Would you like to make that as your learning issue?
Yes, Doc, I would glad to.
Throughout the discussions, the students will naturally quite pose questions on aspects that they do not understand or need to know more about. These questions will also be recorded by the scribe. This will be the learning issues. Learning issues may be defined as questions that cannot be answered with current knowledge within the group.
Can anyone give us a summary of our discussion for today? Archel?
Yes, Doc, I can. So as a summary, we were presented with a case, MN, 45-year-old male with multiple stab wounds, and with that, we gave hypothesis like hypovolemic.
So, see you tomorrow, same time, same place.
So we have 3 learning issues for today, and I think we should just divide the topics among us.
Oh, may I suggest additional LIs? How about the types of trauma?
Types of trauma. Okay.
We need that right now. Tomorrow we do.
Yeah, Doc might ask about it.
There may be a discussion on different types of trauma.
How about, okay, the mechanism of hypovolemic shock, so that we'll know why the patient had hypovolemic shock because of the stab wounds.
Yeah, I think it's nice to know the time of events that led to how it happened to the patient, how it went to shock. I think it's nice to know.
I guess we will get a little bit of physiology.
Yeah, that's physiology. And the management, how to manage hypovolemic shock.
I volunteer for the mechanism of hypovolemic shock.
Let's have to draw that. Yeah, it's fair.
I agree, so everybody can share and study the topic. It's nice.
As a group, they will have to prioritize the learning issues, set learning goals and objectives, and allocate resources. Identify which tasks each member of the group will do. They will then break the session for the individual self-directed study and preparation for the presentation to the group.
So everyone has their own LIs?
Yeah.
Yes.
Let's go.
Bye guys.
Self-directed learning, or SDL, is where students learn the most. It is training for lifelong learning. In the field of medicine, knowledge changes every day, and what you know now may not hold true 4, 5 to 10 years later. SDL is a process that teaches you to identify your weaknesses, your needs, and how to look for answers. This way, no matter how the information changes, you'll be able to know the answers because you're cognizant of the process of learning. Students reconvene as a group. The facilitator starts the session by asking the students the questions that were written still on the whiteboard.
Hello.
Hello.
So, how was your study?
Good. Productive.
Productive. Attendance, please.
Mind breaking.
Mind breaking. Mind breaking. Before we further discuss our patient, let's go back to the learning issues. I'd like to have Salwa talk to us about the organ systems.
Okay, doc. So I was able to read on the anatomy and physiology of the abdomen, and I think it is best if I can show you visually with the help of Johnson.
Students will share their knowledge briefly and effectively.
So the abdomen is divided into 4 quadrants: the right upper quadrant, the left upper quadrant, the right lower quadrant, and the left lower quadrant.
Members contribute additional information or question the facts that were presented. Then the students will apply the knowledge to solve the problem, commit a stand, and make a conclusion.
So let's go back to our patient. What do you think is the management of this patient?
I think, Doc, that since our patient is in hypovolemic shock, as we've discussed yesterday, due to blood loss, most probably, I think it would be best if we gave our patient volume expanders, Doc.
What about the injuries? What management would you be giving to this patient?
Since he has multiple stab wounds to the abdomen, Doc, maybe it would be better if we first tried to get imaging exams so that we could visualize the damage to the internal organs by probably having a CT scan of the abdomen.
Archel.
Based from my readings, doc, if the patient already has a rigid abdomen or guarding, then we can already consider it as a surgical abdomen. And in these cases, the management is already surgical.
What procedure is that?
We might need, doc, we explore the patients so we can see the extent of the damage and know if we see it, we can repair it as we go.
Yeah, I think that's called exploratory Wait lang. exploratory laparotomy.
Correct. Very good move. Very good. If we're going to do exploratory laparotomy, are there any criterias for doing that?
Yes, I said it yesterday.
Students will give feedback by assessing the new knowledge, the problem, and the effectiveness of the process being used.
For the past few days, we've been discussing this case of NM with the multiple stab wounds. So we went through chief complaint, the history, the physical exam, impression, and management, and the learning issues. How would you evaluate yourself? Archel, you guys, in terms of the knowledge and the learning that we had the past few days?
For me personally, Doc, I learned a lot today, especially looking into the anatomy and physiology, and we were able to look into several references.
I say this is a very nice case because most likely 99.9% chance that we will encounter this in our profession.
And besides that, we must also learn that we must be judicious in selecting paraclinicals, especially when we must identify the patient needs immediate care.
What I can say about the session is that coming from a biology graduate, I appreciate the session because we can talk openly and a bit candidly about a case like this, which we honestly do not have much experience on. So there are terms that we get to know along the way, like takip niya and stuff, and I think that this eases us into going into really the field of medicine with this kind of conversations.
As a biology graduate, I actually learned not just from my own readings but also from the help of the group.
As we all know, not all of us know technology, and I really appreciate what Johnson showed us in the Samsung TV, and the session was not boring as I expected. It was fun, and I learned a lot from you guys. So I'm so thankful, and that's all, Doc.
Well said, Moo. So I also had a great time discussing with you guys, and I look forward to having more sessions with you. Good luck on your education, and I'll see you at the hospital.
Now that you've seen how PBL works, are you ready to learn medicine?